Esophageal cancer is a rare type of cancer that makes up 1% of cases in the U.S., and it's often diagnosed in the advanced stage. We'll talk more about this with Dr. Kumar with Austin Gastroenterology and why it impacts men more than women. Good morning, sir. How are you?
Good morning, Casey. Good to see you.
Yeah, you too. So first of all, why is it often diagnosed in the advanced stage?
Well, esophageal cancer, we should say April is Esophageal Cancer Awareness Month, and the reason for the season for this month to talk about it. Esophageal cancer, when it occurs, it blocks the esophagus, and the symptoms that it causes, which are difficulty swallowing and sometimes, vomiting blood, by the time those symptoms occur, it takes a while. And esophageal cancer, for whatever reason, as it grows, the cells become less sticky. They don't stick to each other very well. And then so by the time you find it, there's some cells that have already escaped the primary cancer and spread to some distant site. So when you find the tumor, you treat the tumor, you take the tumor out or whatever you're going to do, it ends up that there's already some kind of spread. It's an early spreader, and that's why it's so difficult to treat long term.
Yeah, and this type of cancer is more common in men than women, but it does impact women. Tracy Braxton, sister of singer and actress Toni Braxton, died from this last month. Why is that?
Yeah, that's a great question. We don't know exactly why it's more common in men than women, but there's also race disparities as well. Caucasian men are more likely to get it than African-American men, but just slightly. But both African-American and Caucasian men are way more likely to get it than either Caucasian or African-American women. So this gender preference is unclear of exactly why that is. It has to do something with the Y chromosome, obviously. More importantly, reflux seems to be a risk factor. So particularly, and age also is a risk factor. People above age 60, 67 is the median age at which people are diagnosed. And so smoking and drinking are risk factors, probably because they increase your risk for acid reflux. And so when you look at a middle-aged, 60-year-old African-American Caucasian man with reflux, particularly those people that start having symptoms, or even when you're going in for your routine screening colonoscopy, if you have symptoms of acid reflux, it's time to discuss that with your doctor and see if some kind of screening or surveillance would be appropriate.
How is the cancer treated?
Well, once you get diagnosed, and usually the symptoms that you really need to pay attention to is the ones I've stated before, is difficulty swallowing and specifically weight loss. So if you have weight loss, don't wait. If you have difficulty swallowing and your weight's going down, get in to see somebody. Once you diagnose it, it depends on the stage. If it hasn't spread too far, then certainly taking the cancer out is appropriate and it'll improve your survival. Even if you do take it out, radiation treatment works quite well and chemotherapy works quite well. Sadly, overall, the cancer is not the easiest one to treat, and your 5-year survival rates end up being about 20% only, where there's other tumors that you can treat much more successfully. So it's a tough tumor to treat, and that's why paying attention to the symptoms, even though it's not very common, 1% of all cancers, if you have these symptoms, if you have chronic acid reflux and you're hitting that age, 50s and 60s, it's time to talk about it with your doctor and let's prevent it.
Dr. Kumar, thank you so much. Where can people find you?
You can find us at drkumar.com, and any gastroenterologist will help you. Austin Gastro is a great place. That's where I work, and I think that we do a great job in diagnosing and treating these disorders.
Thank you so much, Dr. Kumar. We appreciate you. We'll be right back.
Thank you.